Hi, I'm Rob Reiner, founder of Parents Action for Children, the nonprofit organization that produced the I Am Your Child video series. I started Parents Action to help educate parents, caregivers, and others about the critical role they play in the development of young children and making the interests of families and young children a national priority. Please take a minute after viewing this program to visit our website, www.parentsaction.org, where you'll find other useful parenting resources and educational materials, including more I Am Your Child videos. You'll also learn how you can connect with other parents to help make sure that all of America's children have the support they need to reach their full potential. Thank you. Hi, I'm Rob Reiner, and I want to talk to you about smoking, especially you young women who are pregnant or even thinking of having a baby. By now, pretty much everyone knows that smoking is bad for them. You hear it all the time about how smoking causes cancer and lung and heart disease. It literally can kill you. And women are particularly at risk. But please, don't tune us out. We are not going to give you a lecture. What we are going to do is show you some of the things that may surprise you about smoking during pregnancy and beyond. We're also going to give you some help to stop smoking and stay off cigarettes so you can give your baby a great start. Now, we're not going to try to scare you or blame you because we understand you. A lot of the people who worked on this program were smokers once themselves, and we know that quitting is not just a matter of willpower. It's a matter of getting the right information and support. Women have been getting the wrong information for a long time in the form of manipulative advertising by the tobacco companies. Cigarette companies have targeted women for generations, creating the idea that smokers are cooler, slimmer, or sexier. The ads feature gorgeous, self-assured women, but they prey on impressionable girls.
I started smoking when I was about 12 years old with a group of friends.
I started smoking when I was in middle school.
I started smoking when I was 14 years old because my friends talked me into it.
I guess trying to, be down, I guess what you would call it.
It's all part of the dream that smoking will make you popular.
Everyone else was doing it, my friends. I guess it was the cool thing to do at the time.
I was 13 years old when I started to smoke, and it was something that everybody else did, so I kind of wanted to fit in.
Just maybe you could be one of the beautiful people.
When we were little girls at the sleepovers, we'd have the candy cigarettes and pretend we were in movies smoking and feeling classy. And,
the famous people did that, and they were cool and rich and had all these things that we wanted.
The fantasy is powerful.
It was like playing house, having our wine and everything.
Ginger ale in a wine glass and a candy cigarette. Look at us now.
Now is the reality. Instead of the in crowd, smokers have become outcasts, forced to hide their habit. Instead of beauty, smoking makes you age before your time.
My grandfather on my dad's side, my paternal grandfather, was a smoker. My maternal grandmother was a smoker. Both of my parents were smokers.
That's the vicious cycle. The smoking habit carries on from generation to generation.
Okay, we are dynamite.
Kids learn by imitation. Parents teach, not by words, but by example. But the cycle can be broken.
I'm 9 years old and I'm not ready to take that chance. And I don't even think that I want to smoke, even when I'm an adult.
Samantha's convinced her mom to quit.
I'm glad that she doesn't smoke anymore because she found out that it can kill many, many people and it can hurt your babies if you're pregnant.
Now she's working on grandma.
What strengthened my resolve this time is the fact that my granddaughter does not want me to kiss her goodnight.
Whenever she tries to kiss me, I don't let her kiss me because she has bad breath and it's because of the smoking.
Every family has a story.
My great aunt, she has one of those speaking tube things, and it would scare me when I was a little girl, to talk to her because I
Few
couldn't
have
understand
happy
what she'd
endings.
say. My great-grandmother died of emphysema, so that should probably be stuck in my head, but it's so hard to quit.
It is hard. More than 1 in 5 women still smoke, and more than 1 in 10 smoke during pregnancy. That's a lot.
A large number of women continue to smoke during pregnancy. Estimates are that nearly 500,000 women every year who are smoking are also pregnant.
Why is it so hard to quit? Well, nicotine is a powerful drug.
Of all the addictions to overcome, the most difficult addiction to overcome is cigarette smoking. Far more difficult than overcoming cocaine, heroin, or methamphetamine addiction.
It's a matter of the chemistry deep inside the brain. The human brain is made up of centers that control speech and sight and thinking. There's also an actual place where drugs can trigger pleasure.
The place where nicotine works is the place in the brain where people derive a sense of satisfaction, a sense of comfort, a sense of warmth, perhaps a little bit of sense of safety.
So it's no wonder that when you're pregnant, a time that can be filled with stress and anxiety, it's particularly tough to quit. But it's so important that you do. Most of you have seen pictures like this of lungs ravaged by smoking. What's not well known is that in addition to increasing your risk of lung cancer, smoking steals the oxygen your body needs to function normally. Imagine then what it does to your fetus when you're pregnant. Actually, you don't have to imagine. We have scientific images to show you exactly what we mean. This is an actual human fetus in the first few months of pregnancy. A fetus gets all the nourishment it needs to grow from its mother through the umbilical cord, which you can see here in this picture. The umbilical cord acts like a big blood vessel. If the pregnant mother smokes, that blood vessel gets constricted.
When the blood vessels constrict, that means that's restricting blood flow and nutrients and oxygen to the developing fetus. Therefore, the fetus does not grow.
I had a vision of this unborn child inside of me choking and coughing on a cigarette.
When you're pregnant, chances are you'll have an ultrasound, which shows your baby growing inside you.
So Kim, your baby's doing well on the ultrasound. We're seeing, actually here's the diaphragm of the baby with the heart beating, and it's showing that the baby is actually breathing.
Kim is trying to quit. To motivate her more, she wanted to see this demonstration of exactly what smoking is doing to her baby.
And we do know that when you smoke, you're going to decrease your oxygen, and actually the baby does feel that change. And actually we can see that now, while the heart is still beating, obviously, and the baby is alive, the diaphragm is very still, and it's not moving anymore, so that the breathing movements have stopped. And that's an effect of smoking.
So the baby's lungs will be affected, and the rest of the organs will be affected, most likely as well.
Organs like your baby's brain. When you smoke, the environment your baby lives in becomes poisoned.
You see, the baby swims in amniotic fluid that's filled with nicotine. The blood that comes through the placenta is pumping in nicotine at levels that are even higher than what the mother's circulation has. So a baby is really consumed and absorbed and swimming in nicotine through the whole pregnancy. Now, the long-term consequence may be that what you actually did by continuing to smoke through the end of your pregnancy is that the baby's developing brain, from the size of a walnut to the size of a cantaloupe, actually became a smoker's brain.
So if you smoke while you're pregnant, you cut off oxygen to the developing fetus, and that can cause a lot of problems. Smoking during pregnancy has been shown to increase the chance of miscarriage and of a baby being stillborn. And this includes a pregnant woman's exposure to what's called secondhand smoke. So if your partner or others around you are smoking, they're putting your baby at risk too. In many cases, the effects of smoking can't really be seen until a baby's born. That's when many parents come face to face with the consequences.
I was 19 when I found out I was pregnant. I was really, really scared, and I remember the first thing I did was pick up a cigarette.
What are you doing?
And it wasn't until I had my first ultrasound that it really hit me that there was a living human being growing inside of me.
Jenna knew it wasn't good for the baby, but that wasn't enough to make her quit.
Even though I cut back, I never quit completely, unfortunately. I would smoke when I was upset, I would smoke when I was mad, I would smoke when I was tired, I would smoke when I got up, I would smoke when I was bored. But it's hard.
As her pregnancy progressed, Jenna became more worried for her baby.
In my 9th month, when I knew that I was going to deliver, I was pretty much in denial that I was going to deliver. And I was nervous.
Jenna's baby was born small.
When I hear her cry, I think about the fact that I smoked while I was pregnant, number one, and I feel guilty.
Jenna has a point. By smoking during pregnancy, she increased her baby's chances for more colds, for earaches, respiratory infections, and flu. Jenna's baby was lucky. The problems can be a lot worse.
When you smoke, you increase the chances that your baby will be born too small. Being born small is not a good thing for babies, and they often end up here in intensive care. They often have trouble breathing, they have trouble eating, they have trouble growing, and they have trouble maintaining their temperature.
We don't want to scare you, but you've got to know the truth. A number of babies in intensive care units like this one have serious complications. And while not all these babies' mothers smoked, for many here, it may be months before they go home with their parents.
A baby that has to be in the hospital in an intensive care unit, sometimes for 3, 4, 5 months and more. Obviously, for those babies, the financial cost is tremendous. A lot of them are on mechanical ventilators, need 1 or 2 nurses at the bedside at all times. And what this does to a family, what this does to parents, they're completely separated from this most fragile being.
It's a tragedy for the mom. It's a tragedy for the baby. And one of my patients actually evoked an image where she said that every day when she continued to smoke, she felt like it was the equivalent of putting her baby, sitting her baby down on a railroad track.
That's the bad news. But the good news is, if you stop smoking before or while you're pregnant, you'll end up with a healthier pregnancy. Your fetus will grow better, your baby will have less chance of being born too early, and will be bigger and healthier. Finally, you'll be able to take your baby home with you sooner. And once you're home, you gotta stay off cigarettes, and tell those around the baby to stop smoking too.
Everybody smoked in the car, in the house, all the time. Actually, when I was in the 4th grade, my teacher asked my mother at parent-teacher conference if I smoked because I always smelled like smoke.
Secondhand smoke is very dangerous for your child.
When babies are brought home to households in which there are smokers, certainly those babies can be a tremendous risk for any number of chronic diseases having to do with the lungs, like asthma, allergies, upper respiratory tract infections.
And we're very concerned about something called sudden infant death syndrome, or SIDS, where the babies will suddenly die. This risk is increased with smoking in the house.
The amount of smoke a cigarette gives off is astounding. Watch this laboratory demonstration. Smoke coming off the tip and into the air is actually more dangerous than what the smoker inhales because it's completely unfiltered.
Now, for anybody in the room, we sucked the smoke out through a filter. When we started, the filter was white. After the smoke of one cigarette passed through it, look at the color change. That brown is all the smoke, tars, and nicotines that you would be inhaling into your lungs if you were near someone who was smoking a cigarette.
If a mother smokes, she is affecting her baby right from the first. If a father smokes in the same house, he affects that baby too.
Dads have to be careful at home, and even in the car. A baby's car seat can trap a tremendous amount of smoke.
When I got into the car and thinking about lighting up a cigarette with my daughter in the car, I think the increased risks of secondhand smoke doubles just in that small area. I mean, everything I've heard in the news and everything I've read in literature, secondhand smoke's just as bad as primary smoking, so why endanger the life of my young daughter if I'm going to smoke a cigarette?
As the child gets older, there are still more consequences. Exposure to smoking has been shown to hurt children's chances to learn and succeed in school. And for children born with low birth weight, test scores are lower, behavior problems greater, and they're much more likely to drop out of school. So quitting before or during pregnancy will let you feel good about what you're doing for your baby. And staying off cigarettes will help your child be healthier and succeed better in school. Now the big question, how do I quit? We know it's one of the toughest things in the world.
It is hard going through morning sickness and all the other changes that you have when you're first pregnant, plus trying to give up cigarettes. It's so difficult.
If I don't get up in the morning and have a cigarette, I'm like shaking.
The first time I quit smoking, I lasted about 48 hours.
Most women think, gee, when I get pregnant, I'll just quit. And what happens is they get a big surprise. They find out that they thought they could quit. And when they try to quit, particularly during a time like pregnancy, which is a time of stress, that it is very difficult to do so.
If you decide you want to quit smoking and you're having a hard time quitting on your own and you need to ask for professional help, don't wait to do that. Do it right away.
The first time I went without a cigarette for a total of 2 hours. And then
the first step in quitting can be as simple as seeing your family doctor or healthcare provider.
Okay, well, we have 3 tools that we use in order to do that. The first tool is medication. Now, you're pregnant at this point, and so using medications in a pregnant woman can be a little bit tricky. That's why I want to work with your doctor.
There are important psychological factors in smoking, too.
Could you envision a day where they're going out and you're not part of the smoking group? Could you envision that?
The other tools that are available to us include individual counseling.
Do you have a pattern?
You work on the obstacles to quitting that are apparent in your life.
The last time when I stopped for a week, I actually almost gained 10 pounds.
In fact, the most powerful obstacles to successful quitting are a lack of understanding of what they're about to go through, an unrealistic expectation that they really ought to be able to simply put the cigarettes down and never pick them up again, and an unrealistic expectation of what is likely to happen to them in terms of their weight.
When I first quit, I walked around with a spoon in my mouth for like 2 weeks because I think that's one of the hardest things, though. Is like
support groups are particularly effective in quitting. You get to talk with others going through the same thing and learn you're not alone.
Doing that alone with just you and your addiction doesn't give you the social support and networking that you need to be with someone else who actually becomes a buddy, a friend, who helps you through the process of recovery. Because quitting smoking is not an event that just occurs one day, it's a process.
Along with traditional therapies, there are also toll-free numbers you can phone called quit lines.
This is David. How may I help you?
You'll find a friendly, knowledgeable person at the other end of the line who can give you real help to stop smoking.
Try and think of some other things that are motivating you, things that you didn't happen to think about on the phone with me.
The key in quitting is to be motivated and realistic, but not to be too hard on yourself.
You need to not beat yourself up, not feel like a failure, not feel like I don't have enough willpower to do this, because it's not about willpower, it's about learning skills.
As we've said, it's best to quit before you're pregnant. But if you quit any time during your pregnancy, you'll be taking a big step toward having a healthier baby. And staying off cigarettes once your baby's born is critical. And that means everyone who's around the baby, too. So make a decision. Call for help today. At the end of this video, we'll give you a few resources you can phone or go to online. And there are plenty more in your local community. Just ask your healthcare provider. Take that first step, then stick with it, so you can say that you've done all you can to give yourself and your baby a great start.
It's an addiction, definitely an addiction, but you can overcome it.
You can do it if you put your mind to it.
It'll be good for you, it will be good for the baby.
I just made everybody stop smoking in my house. My baby's coming.
I do whatever it takes to make sure that my baby's healthy.
Stop because it's the best decision that you could make, because I did it. If I could do it, anybody could.
And if you don't smoke, don't start.
Don't give up. Don't give up. You know, don't give up on yourself.